Alaikum. Uh, Clinical CVS station aortic stenosis with William. So as the previous video, we'll do the examination and now how to present the case. So today I have examined William, 7 years old boy who was cooperative and seems to be well grown for his age. However, I want to do the anthropometry. He is pink in color and I can appreciate the features of Williams syndrome: full cheek, white mouth, and there is white mouth with full cheeks, and he had no features of clubbing, stenosis, infective endocarditis. On precordium examination, precordium is bulged and there is thrill present in aortic area, and there is a murmur, ejection systolic murmur at the right second intercostal space, grade 4/6, and it had no radiation. And to complete my examination, I want to look the back, do the anthropometry, look at the groin area, measure the full limb BP and oxygen saturation. And considering all my provisional diagnosis, it is a case of Williams syndrome with acyanotic heart disease, most probably aortic stenosis. I will put this in my top of diagnosis, and pulmonary artery stenosis and coarctation of aorta, hypoplastic left ventricle will be my other differential diagnosis, as pulmonary artery stenosis is maybe associated with aortic stenosis. However, this pulmonary stenosis murmur will be present on the left side, left pulmonary area. So I exclude this. For this reason, I keep in the differential diagnosis. And coarctation of aorta, this murmur has no radiation on the back, so I exclude the coarctation of aorta. Then how will you manage this case? So for management, I will go through his previous record, and for investigation, chest X-ray normal, or there may be prominently left ventricle. ECG there may be normal, but if there is severe stenosis, so left ventricular hypertrophy or sign of ischemia may present in the ECG, and color Doppler echo for the site of the lesion and also for the pressure gradient over the valve. So management plan through the multidisciplinary team, where the pediatric consultant will be the team member, cardiologist for the medical and the surgical issue, and dietitian for the growth monitoring, and dentist for oral hygiene, maintenance of the oral hygiene, and genetics, as it's a Williams syndrome, and liaise with the school, involve the school nurse, and I will want to do the formal developmental assessment here also. And the treatment option, if the pressure gradient over the valve is more than 60 millimeter of mercury, so the option is valvoplasty. Most of the cases is conservative management, and if it is failed, then valve replacement therapy. And we will keep the patient follow up and give the cardiac advice. Cardiac advice is avoid tattooing, avoid body piercing, and maintenance of the good oral hygiene, proper nutrition, and avoidance of heavy exercise. And we will teach the parents the signs symptoms of infective endocarditis. And other question may be that how can you say that it's a supravalvular aortic stenosis if there is ejection click is here? And in Williams syndrome, along with the supravalvular aortic stenosis, there may be peripheral pulmonary artery stenosis. in case of valvular aortic stenosis, often its presence with the coarctation of aorta. Subaortic aortic stenosis, there is no ejection clip, but there it is very prone for infective endocarditis. So, presentation of aortic stenosis, patient may present with dizziness, palpitation, chest pain, and in severe case syncope. And what pulse you are suspect may get in case of aortic stenosis? Pulse may be collapsing, may be normal, or narrow pulse pressure may present. Blood, however, what about the blood pressure? Blood pressure may be normal or slightly raised, narrow pulse pressure may present. In case of supravalvular aortic stenosis, there is possibility of the high blood pressure in the right arm. And here the radiofemoral delay may be present for association of aortic stenosis with coarctation of aorta. So how to differentiate it is due to coarctation of aorta or aortic stenosis, because coarctation of aorta murmur radiates to the back, but in case of aortic stenosis it does not radiate to back. Thank you.